Last year, when measles swept through Samoa, health workers went door to door with the measles, mumps, and rubella vaccine. They immunized 90% of the population, both children and adults. Then the coronavirus raced through the world. But oddly, Samoa in the Pacific Ocean has been largely spared. Madagascar, Hong Kong, and South Korea also had recent measles outbreaks, vigorous vaccination campaigns, and lower rates of COVID-19, the disease caused by the new coronavirus. Researchers began to wonder if there was something to this vaccine, which is often called the MMR vaccine. Jeff Gold of World Organization ran the numbers.
There's a clear correlation between the MMR, measles, mumps, rubella vaccination, and populations who have greater immunity from COVID-19.
Then Gold looked at countries with low vaccination rates for measles and found the opposite.
Italy was one of the least vaccinated with MMR in 2002 with under 80%. Then came the United Kingdom, then came France, then came the United States, and then below that, Germany.
Gold's data shows that where the MMR vaccine was given to adults, they were far less vulnerable to the coronavirus than their counterparts in other countries. A study at the University of Cambridge showed that it was the rubella portion of the MMR vaccine that seemed to confer immunity. Scientists in several countries are researching this theory. A study of Syrian child refugees at one of the camps in Turkey showed that they were 6 times less likely to be hospitalized with COVID-19 than Turkish citizens. Turkish researcher Dr. Ramazan Okyay says larger studies are needed.
Yapılması gereken
What needs to be done is a study with people who had MMR vaccines, other than children like migrants, soldiers, travelers, and compare them to a similar adult group who didn't have MMR.
Dr. Anthony Falchi, the leading infectious disease expert in the U.S., says anything people can do to improve their health and protect themselves against a disease is worth doing, especially during a pandemic.
There is the theory that if you vaccinate someone with a potent vaccine against, let's say, measles, that in fact that would give you protection that also protects you against coronavirus. That is a theory that hasn't been definitively proven.
The researchers hope their studies can prove it. If true, the measles, mumps, and rubella vaccine could be widely used around the world without further trials because it is safe and readily available. The hope is that it could protect us until there's a vaccine against COVID-19. Carol Pearson, VOA News, Washington.